Good morning or good afternoon. Again, good evening to some of you who've joined us today for discussion on better integrating nutrition into USAID funded resilience programming. My name is Tom Spangler, and I'm the Chief of Party for Research and Learning for Livelihood Security and Resilience here at Save the Children US. I also serve as the Activity Director for the Real Award, who's presenting today's presentation, the webinar today. This webinar has been organized through the Resilience Evaluation, Analysis, and Learning, or REAL Award. And that REAL is a consortium-led effort funded by the Center for Resilience and implemented by Save the Children, Mercy Corps, and Tango International. Now, under our second iteration of the activity, REAL consortium members are working closely with our counterparts at the Center for Resilience and the Analysis and Learning Division and other key stakeholders to address some of the emerging research and learning priorities related to resilience programming. Among these priorities is clarifying linkages between resilience capacities and health outcomes, including nutrition. So as part of this effort, Save the Children has developed a discussion brief on better integration of nutrition into resilience strengthening programs. Nancy Mock, the lead consultant who worked closely with Joan Jennings, our senior nutrition advisor for Save the Children, will be presenting the brief today. We definitely look forward to hearing your feedback on this initial effort and hope to solicit some of your suggestions on potential next steps. So before we get to the presentation, I'll first pass it over to John Meyer, Senior Strategy and Impact Advisor for the USAID Bureau for Resilience and Food Security Center for Resilience. So John, over to you.
Thank you, Tom, and great to be here. Nice to see everyone. Yeah, in addition to what Tom just said, I'm also the AOR for REAL 2, and actually very, very happy that this came together in this way. It's been in the works for a while, and so we're really excited to be with you today. Obviously, here to discuss the discussion brief on better integration of nutrition into resilience strengthening programs. Want to hear what the researchers have to say and also get your feedback and ideas as well. If you take a look at the GFSS framework, you'll see both resilience and nutrition in very prominent kind of SO level positions. And I think we agree in principle anyway that these aren't separate strands or streams, but kind of a integrated, interrelated part of a whole. One can not live without the other, so to speak. So in that sense, how do resilience and nutrition fit together is the question at hand. We know that nutritional status has been a well-being outcome through which or with which we measure resilience at times. And in many ways, resilience fits in among the sources of resilience that will be, I think, shared later. Just bottom line, well-nourished communities are by nature better able to deal with shocks that they face. And many of the sources of resilience, social capital, women's empowerment, a healthy natural environment, these are sources of resilience, but also contribute to better nutritional outcomes. In the long term, and resilience is a long-term concept, ensuring a well-nourished population, along with health and educational outcomes, are just essential for overcoming, kind of the intergenerational transmission of poverty and ensuring kind of the long-term economic growth with resilience that we seek. So the discussion note that will be shared today is a really excellent first step in this process, this effort by REAL to integrate nutrition and resilience strategies. We really want to thank everyone involved here, Nancy Mock, Emily Marshall, and Tom Spangler from REAL, who worked hard on the discussion note, with support from counterparts here at USAID, from Center for Resilience, Center for Nutrition, and the Bureau for Humanitarian Assistance. I'll quickly name them: Ingrid Weiss, Sean Wozniak, Mike Mansky, Leslie Koo, and Madeline Smith. A lot of hard work has gone into it. And I want to thank you again for joining, and I will pass to my old friend Nancy Mock to get us going. Thank you.
Hello, everyone. Good morning, afternoon, evening, wherever you are. And hey, John just gave the presentation. So it's great to be with you. And, I just want to say a few words about myself. I've been kind of at this topic for a long time. Actually, starting in 1983, I wrote a paper, maybe one of the first ones, demonstrating that weight for height and height for age were not intercorrelated the way we expected. And so over the years, I have been fascinated by this topic of nutrition and how we actually can beat it, how we can beat malnutrition. I worked in my earlier career on the Famine Early Warning Systems project as one of the co-creators of that initiative, and also in some other capacity ended up pushing forward the SMART initiative so that we could get to the point where we measured malnutrition in a consistent way. And one of the overriding comments I would make about this particular topic, the integration of nutrition and resilience, is that nutrition, although it's talked about a lot, and it's a lot of lip service is given to the importance of improving nutrition, the funding for the immediate, for interventions that are more classically identified as nutritional interventions focusing on improved dietary intake and the management of nutrition-related illness has been very modest in comparison to many of the other sectors that contribute to nutrition. And I think as we go through this, the whole point of this exercise was to try to make the linkages between various interventions and nutritional status much more clear, and to advocate for the development of theories of change that are explicitly integrating nutritional concerns into our vision of achieving resilience. So Emily, would you like to put up the first question, please? I thought it would be interesting to ask a question just to see where you are on your own thinking about this topic. Which is one of the most important indicators in the integrated phase classification for food insecurity? Bingo, GAM, acute malnutrition, food consumption, nutritional status. Okay, so what we know, and frankly, these nutritional outcome measures, the biomarkers, and some of these dietary related indicators are very significant and are measured and really drive the IPC classification, and for sure are key features of IPC 4 and 5, the worst manifestations of food insecurity. So could we go off to the next slide, please, Emily? So the concept note is, is available for your perusal. As John had mentioned, it was a long time in making, and for that reason, my feeling is that this needs to be, in many ways, a living document. As we will talk about through this presentation, there are so many important innovations that are occurring now, and many of them affecting our understanding of biological, social issues like nutrition and, frankly, behavior change. But there's so much going on right now that I think our knowledge, our understanding of how to improve nutrition is going to change really rapidly in the near term. So We know that optimal nutrition, as John said, is fundamental to achieving USAID's wider mission. And it is, as John mentioned again, both an input to resilience and an outcome of resilience. We consider it an important well-being outcome for resilience and sustainable development. But we also know that coming into a shock environment, coming into a situation where you're exposed to many shocks, resilience is also an important mediator of resilience capacities. So it's important throughout the sort of causal model. And that in terms of terminology, and in the discussion brief, we do lay out terminology that helps nutrition people understand some of the resilience parlance, and helps the resilience community that hasn't been really into the weeds on nutrition understand some of the nutrition parlance. And so some of that is that nutrition specific interventions address what we call the immediate causes of malnutrition, primarily dietary intake related, the intake of nutrients, and the utilization of nutrients, things that affect how nutrients are actually used by the body. That's conditioned in part, at least in a major way, by infection. And then nutrition sensitive interventions, which are addressing the underlying cause and sometimes the basic causes. If we really want to talk about transformational change, basic causes. And many of these are ones that the Center of Resilience and also the Bureau for Humanitarian Assistance has been embracing and addressing fairly aggressively, such as livelihood diversification, agricultural practices, and women's empowerment. Next, please. And so this is an overview of what the contents of the brief are. It is a brief. It's not wordy, and hopefully we get to the point in most questions, but really tries to integrate these concepts of nutrition and resilience and identify areas in which we can do better, and also areas where we need further research or improved learning. Next, please. Now, this is one of the things that we didn't mention at the beginning was that my co-author, Joan Jennings, is a very seasoned practicing nutritionist who's worked with the practice community for many years. And I was very delighted to have her as a colleague, because she has been in the field and can really feel what's working and not. And she thought to add this particular slide, which is that although child and maternal nutrition indicators are a concern in the country we work, there's a lot of pessimism at times, and yet large percentages of children and women are not malnourished. And so identifying some of these factors is really something that we should be paying more attention to. So we shouldn't be discouraged by some of the findings that at times these indicators are not moving as quickly in the direction that we'd like to see them move. And as I'm going to continue to reinforce, there have been major breakthroughs in our understanding of how to achieve social and behavioral change, as well as emerging breakthroughs about the biology of malnutrition. So we have to understand that we are at a moment when improving nutrition is possible, and it's necessary, but perhaps not a sufficient condition for achieving resilience. Next, please. So this is just a takeoff of the UNICEF conceptual framework. I have retained the increased burden of disease as a particularly important immediate determinant, simply because as you look at how shocks and stresses affect the sort of the causal framework relating to nutritional status and mortality, which is quite clearly important when we look at shocks and the impacts of shocks on the well-being of populations. that we can see that the effects of population displacement, compromised, overwhelmed emergency response and recovery system leading to that, compromised food systems, trauma and depression, compromised environmental systems, interrupted and reduced access to quality social services. These all really operate to decrease the availability and access of food and important services, environmental services, and an area that we're just beginning to understand more about, compromised childcare and self-care related to things like depression and trauma. So that this is sort of our understanding of how shocks and stresses affect nutritional status and through what pathways. Next, we'll move to adapting. Next slide, please. Adapting the resilience conceptual framework to include more explicitly nutrition and nutritional considerations. So here we have, if we go to the actual outcomes, I always like to start there in my thinking. So the outcomes here are related to either embarking on a resilience pathway, that is bouncing back or bouncing back better, or moving more to a vulnerability pathway. And what we know is that in many cases, when shocks occur, we have increased GAM rates, increased humanitarian caseloads and mortality. And that's certainly what we want to avoid. Clearly, caseloads for which GAM is a high correlate, frankly, is really, one of the big points of of resilience programming. Compromised gains in nutritional development. So in this case, malnutrition may increase, but it's not a humanitarian phase 5, phase 4 IPC, but perhaps some diminished nutritional status. And this often happens, for example, related to seasonal shocks, that we often see that kids' nutrition is compromised, that they start to compound nutritional insults that lead to linear growth failure or stunting, and often also retain higher levels of acute malnutrition. Or on the other hand, they can bounce back or bounce back better. They can maintain nutritional status, or they can actually improve nutritional status. So if we move back from that, those are the pathways and the outcomes of interest. We can look at some of the capacities that actually may contribute to outcomes. Caretaker nutritional competencies, household monitoring of nutrition is a more recent development. Scalable structures such as scalable, robust CMAM programs and food systems. Here we know, and it's interesting that in the case of the arid lands in sub-Saharan Africa, we're still in need of CMAM programs, and we're still in need of scaling those up. And in the case of Kenya, at least, there's pretty robust evidence that suggests that that capacity to scale up CMAM has actually led to a reduction in mortality. So a very important step in the right direction. And then strategies such as nutrition sensitive, shock responsive social protection. We'll talk a little more about that. High nutrient density in agriculture. And then another strategy that I think we think it really deserves a lot more exploration and deep dives is how, when we combine typical behavioral interventions with livelihood support interventions or livelihood interventions, we may actually see better results. So some appreciation of the need for enabling environments for behavioral change to occur. And so here you have, prior to that, natural hazards, conflicts, food shortages, price increases. In general, there are many disturbances, COVID, pandemics, price shocks of various sources, stresses such as land degradation and fluctuations in water availability, important stresses. And nutrition itself can be a stress poor nutrition in the community, chronic energy deficiency, and things like the high cost of a healthy diet. So this, in fact, situates nutrition within the context of the resilience conceptual framework. Next, please. And just a few, we're not going to spend a lot of time on this, but again, these absorptive, adaptive, and transformative capacities that are important for nutrition. The shock responsive safety net services, be they through, ideally through government shock responsive safety net programs or through humanitarian programs. One of the things that we have noticed again and again is that resilience programs, oriented programs, are often insufficiently powered such that that nutrition can be maintained without some type of safety net response. So we often find that, you know, nutrition, if you look at the nutritional status of individuals in resilience intensive programs versus not, the nutritional status definitely is better, but nutritional status, as we mentioned in the prior slide, is still declining because we're just not doing enough. So we have to better protect the investments in resilience if we want to see nutrition maintained, and consumption smoothing is a key piece of that. And so we're also looking at, again, linking better, integrating better, behavioral change with other initiatives. This is another key piece of improved absorptive capacity. Adaptive, a lot of it focuses on the cultivation of the nutrient-dense, drought-tolerant crops, access to utilization of financial services and natural resource management. When again, the important thing here is to better link these initiatives with behavioral change interventions. And then strengthening women's economic and social roles, which is both adaptive and transformative. What we know is that when shifts in women's empowerment occur, and this is often promoted through these financial inclusion activities, that this is an excellent moment to promote behavioral change using more modern methods, such as ecological approaches. And finally, I did want to say in arid lands, particularly where GAM levels are high now, the idea that we need to scale up rapidly these safety net, shock responsive safety net programs is quite an important transformative capacity. And again, it's good to see that we do have some evidence that they work, at least in preventing mortality. Next, please. In this, you know, all kind of flows nicely from USAID's focus on humanitarian development peace coherence. The idea that really, if we're going to tackle some of these multi-causal problems like nutrition, we've really got to do a better job of using the tools we have and using them effectively towards goals like the reduction of malnutrition. So, you know, whether it's adopting portfolio approaches, you know, or even broader. So, you know, the idea of scale up of CMAM, oh, well, it's really great if you can layer with UNICEF. UNICEF's doing a lot of the legwork on CMAM in many countries, and layering with UNICEF, you know, government programming on that can be a win. Sequencing, layering, and integrating to ensure consumption stability, and that SBC is layered and integrated. And a lot of the breakthroughs we know in SBC have been the modernization of SBC to understand, you know, really much better what drives behavior. And frankly, what we do know is evidence from USAID's FANTA's assessment of SBC activities with the resilience food security activities, is that we're not particularly employing modern techniques and understanding of how to achieve behavioral change. So we definitely need to better sequence, layer, and integrate interventions to achieve the ecological environment that leads to behavioral change, to normative change often, and to change that's hard to occur with message-driven approaches. And then to prepare to scale up nutrition-specific interventions during shocks, we just mentioned, the other is to consider the complex relations between shocks and social response. And we've seen and learned a lot from COVID about how trust of stakeholders is so important for achieving change. Next, please. So one thing is really important, and it's not been much of a focus of a lot of the work, is to analyze nutritional outcomes and including intermediate outcomes like diet in relation to these initiatives. That is, being able to look at the impact of these initiatives on diet. Next, please. And then another important need is more explicit monitoring of nutritional indicators as part of resilience initiatives and resilience-oriented programs to measure and monitor nutritional status in the face of shocks and stresses. It's interesting, we're doing remote RMSs, recurrent monitoring systems and such. They rarely collect nutritional data, perhaps some dietary indicators or coping strategies, but not the ultimate indicators of impact here. So we need to be doing a better job of monitoring wasting, stunting food consumption, dietary quality, and infection, and also be able to follow these over time, to look at the relationship, the temporal relationship between coping mechanisms and their effects on nutrition. Next, please. And so we've also identified some future directions, seek a better understanding of the effects of resilience approaches on nutritional outcomes. And then a question of, if we really achieve demonstrable improvements in resilience, do wasting levels improve in the absence of CMAM? So can we wean ourselves from CMAM? Right now we need it. Certainly in many of the ASALs, because we have such high levels of I don't want to say normal levels of GAM, but we have very high levels of malnutrition, and at the moment, at least, we certainly do. But can we wean ourselves from that? And then what else is needed to better integrate nutrition into resilience programming for meaningful improvements? So how can we do a better job? We think that this is an excellent time to focus on this because we can, and we know a whole lot more about how to change behavior and also the biology of malnutrition. And with that, I think we open it up to questions.
Great. Okay, thank you, Nancy, very much for that presentation. Again, I know that was condensed, and as Nancy said, we do encourage everyone here to take a look at the full discussion brief if you haven't had a chance to do so thus far. I see some are adding questions into the Google Doc now. Thank you for that. Nancy, I'll just point to a couple of them that are there already. And the first one is just a comment from Mike Mansky, but a helpful one. And he's just reiterating an appreciation for considering, say, normative change and gender as those contribute to transformative capacity, noting that, as you pointed out, often there's an over-reliance on kind of message-driven approaches to behavior change, and those have returned mixed results for sure. So thanks for that observation, Mike. I'll point to the $1 million question, maybe a good place to get started is the question from Madeline. And Nancy, that is, how are recommended intervention strategies that can lead to strengthened resilience differ from, or how are they distinct from the current mix of recommended strategies for contributing to achieving multi-sectoral nutrition outcomes?
The key thing here is with resilience is we're talking about couching everything in the context of shocks and stresses. And so as you know, sort of typical programming focuses more on, you know, how do you integrate nutrition sensitive and specific interventions, you know, without particularly focusing on the importance of shocks and stresses. So in this case, the you know, the idea is to understand that programming in a shock context is quite different than not. Or let's, you know, say particularly in resilience targeted areas, we know that there's shock exposure and that the risk exposure is much, much greater. So this means certain things like how the, you know, psychology of people might be affected, trauma, you know, in terms of social psychological needs and such, and how agriculture needs to be rethought both as a strategy, but also in terms of how you do it in those environments, right? And so it really is mostly this shock and stress lens that conditions how you think about what can be done, what could be done to really, you know, achieve success in these kinds of environments. And in the past, a lot of it, you know, if you look at the literature, there's very little discussion of either the effects of shocks on nutrition in the sort of in a more holistic way, and then, you know, what that means in terms of what you do in a specific context. So it points to the importance of context specific programming that is particularly sensitive to the shock environment, to the, you know, the shock and stress landscape of that environment. So I would say that.
Okay, thank you very much, Nancy. And I see others are adding questions into the Google Doc, so please keep those coming and we'll address those in order as best we can. So another great question is posed by Rebecca Egan, and this gets in the details a bit more, some things that we've talked about in terms of appropriate indicators for integrating nutrition measurement into resilience analysis. So Rebecca's question is, what's the rationale for using stunting as a monitoring indicator for resilience and nutrition status, rather than an outcome or impact indicator, given that it's not particularly sensitive indicator and there is a potential for inaccurate measurement?
Yeah, I think it stunting is not necessarily an indicator that you would always include. It would depend again on context and what the goals of the interventions were. I think in areas, it's like GAM, in areas where you have very high levels of stunting, you're going to have to address it in some way. In areas where, you know, stunting may not be so high, you know, you may not, you know, it may not be important to track it. So I do think a lot of it has to do both with the context and also with the specific interventions and what you've taken on to change. My personal opinion is that stunting is a proxy for lots of different developmental processes, and in the scheme of things, if you're not improving that and you've got a big problem with stunting in your context, then maybe, you know, you're missing the mark on programming.
Okay, thank you, Nancy. And just to keep that stream going a little bit, let me say first, for those of you who haven't answered questions yet into the Google Doc, if you prefer to just raise your hand and voice your own question here, certainly feel free to do that. A next question is kind of building on that topic of indicators, is asking whether you can share your thoughts on what's most feasible and what would be some potentially responsive indicators of maternal and adolescent nutrition other than diet diversity and anthropometry.
Yeah. You know, we were talking about other than dietary diversity and anthropometry, and I would move, I think more experimentation needs to be done with household MUAC. I think we need to determine under what conditions it can be actually a useful indicator. Because interestingly enough, it could be done remotely. I mean, it could be monitored remotely if it can be. if it can be operationalized. It is anthropometry, but it's not what we usually have used. There are other indicators that we have been discussing among ourselves that have to do with the food landscape and what's available and what's not available, and the enabling environment that allows people to make different dietary choices. So whether that is the availability of nutritious and appropriate foods for young infants, those kinds of things are going to be part of the causal chain in many interventions, and should be considered in a monitoring scheme.
Okay, thank you very much, Nancy. We have a question from Jamie Montgomery that I think sets us up well for talking about potential next steps on this effort. As John had mentioned, and Nancy as well, this is an initial effort, although there's been a lot of thought and effort that's gone into it. We understand there's quite a bit more learning that can and should be done here. So Jamie poses that you mentioned at the end, there was a lot we do know about what works in this space, and asks, are there key research or other gaps that you would prioritize us focusing on in the near term? Now, certainly Nancy and Joan have thoughts on this. They've been thinking on this for quite some time, but I'm sure this group does as well. So in the time that we have left, in addition to Nancy's response, we'd really like to get the feedback from participants here today. What are some of the pressing knowledge and learning gaps that you all feel, or what are some of the research and learning opportunities, including around specific indicators that we might follow up on? Nancy, I'll turn that over to you, to your response to that question. Again, are there key research or other gaps that you would prioritize us focusing on in the near term?
Yeah, again, and I think that they are context specific, because what we do know, like I said, nutrition is a social biological problem, and what is driving malnutrition in different environments is somewhat different. But I think there's a large scope for understanding how to better layer and integrate components of resilience activities to potentiate nutritional change. So whether it be, what is the minimum package in different contexts that actually can lead to nutritional change, perhaps, where you can leverage behavioral change with access to resources, to foods and financial resources. I think that's a really important one. I think in some highly traditional environments where we have very deep-seated normative practices, how to really shake that up, because infant and young child feeding practices in some of these highly shock-prone environments are often very ingrained, and really, what combinations of interventions are going to actually enable us to change normative behaviors. And so to me, that's another important one, in the absence of women's education, because, frankly, I guess if I were controlling development resources, I'd be focusing a whole lot more on education in general. But in the absence of that, and we know we have big problems in many parts of, where we work and where we're trying to do resilience strengthening, we have large problems in literacy and, cognitive tools that people need. And so really, how can we in the short run, deal with that problem until things are, until equity in education and such is achieved? Those would be some. But I want to hear what I really do want to hear what the audience has to say about that.
Yes, thanks, Nancy. And yeah, encourage everyone listening in to weigh in and offer thoughts on that. On next steps on key priorities. Maybe while we're kind of putting forth that request again to participants, I'll give quick overview of what we have planned right now. And again, these are alternatives that we're working with the Center for Resilience, and certainly would want the Center for Nutrition's input on this as well. So understanding that this discussion brief kind of lays the groundwork in terms of basic concepts and definitions and opportunities for improved learning in this area. We want to continue to push this ball forward. So one thing that we are intent on doing is, again, providing further clarity on these linkages through analysis of secondary data. So data that has already been collected, we want to go back into it and spend time to really try to map out as much as possible specific linkages between resilience and nutrition outcomes, and the extent to which nutrition can and has been identified, as we pointed out, both an outcome and a contributor to nutrition in specific contexts. So one is analysis of secondary data. We're in early stages of that, of just putting together an inventory of likely data sets that will be helpful on this front. Those include data sets that have been collected under REAL, both for in West Africa for the RISE initiative, and for East Africa for PREG and PREG2 and other resilience investments. We're also considering whether and how it might be useful to look at BHA data sets that are being collected as part of impact evaluation for resilience food security activities. Those may have, in addition to anthropometric indicators on food consumption, including dietary diversity and other indicators. So we're in early stages of putting together that inventory. One ask is if folks here know of good data sets that would enable us to take a deeper dive into that, please share those. We would also like to have, after, probably before, during, and after we're engaged in that secondary analysis, we'd like to identify those of you who'd be interested in participating in a technical consultation to help us really clarify some of those research questions that would be most helpful for this community of practice to focus on for that secondary analysis. Another option that we've thought of that could result from these first two steps of the inventory, or these first few steps, the inventory of data sets, the secondary analysis, and the technical consultation. Ultimately, we'd like to be in a position, hopefully, where we can put out some normative guidance on how to improve measurement and monitoring of both nutrition and resilience. So let me stop there. Again, it is with an ask for all of you. If you know of data sets, if you have kind of burning research and learning questions in this area, please share them with us now. Nancy, also turn it to you to add on to that if you'd like.
No, I think we'd love to have your input as to questions that have been bothering you about this whole question of nutrition and resilience. So questions that you think are main gaps, as well as opportunities, data set opportunities that you think could really benefit from a deeper dive into the relationships. We mentioned some of the ones we're thinking about, but it'd be also interesting to look at, if we could put our hands on it, some longitudinal data sets, panel data sets, where data was collected over a period that included shock events.
Thank you, Nancy. I see a couple hands up now. John, I think yours was first, and then Rebecca.
Yeah, thanks. I feel that you've probably been speaking to this very issue, but maybe I'll rephrase this point very simply. The proposal, I think, went in quite a while back that in a place prone to recurrent crises, that if wasting itself didn't increase and perhaps even declined, that itself was an indicator of resilience. And I think nutritionists took offense because, when you have wasting as an impact goal, so to speak, but you don't necessarily have the ingredients of anti-wasting programming like CMAM and other things, then you're really messing things up. Do you agree, Nancy, with that proposition?
I think when you have counterfactuals, when you have people who didn't receive those interventions and their nutrition trends were worse, I think you have indications that, something is working here. It's not enough is the answer, so do we, could we layer more humanitarian assistance there? I mean, could we do other things to, keep them on a positive trajectory? But honestly, we've seen this a lot where if many of the Tango impact evaluations will see that the indicators, the nutritional indicators may decline, but they decline a lot worse in the control or comparison areas, right? So to me, that does indicate that you're starting to see some resilience capacity. The problem is we kind of need to do better. We need to stabilize or, hopefully promote improved nutrition over time, even in the context of these shocks, But I totally agree that, people have to realize that if you have a counterfactual, which means you have a group that didn't get the intervention and your intervention group is doing better with respect to maintaining nutritional status, that it is, to me, evidence of resilience. Now, what you have to worry about is that in these shock environments that we're dealing with, we're often dealing with multiple shocks over time. And one of the things that the research is showing that I have seen, there's not a lot of it, but it's the little bit of it says that a lot of the things we do, savings groups and in cash transfers and such, may help people get over one shock, but when they start to experience multiple shocks, we might not have that same effect. So I think there is this caution that in a context of multiple shock exposures, we have to be very careful, and we probably have to be looking at households over time in a much longer time span to really understand, the sustainability of what we're doing with resilience investments.
Thank you, Nancy. I hope that addresses your question or your comment, at least in part, John. I'm mindful of time. I would like to address as many questions as we can in the time available. So Rebecca, I believe you had a question.
Thanks, Tom. This is going to be an imperfect question, but a follow-on from John's question. And it's kind of two parts. I think one of the discussions that we've had internally across various bureaus, and this is sort of what John was speaking to, we've had discussions about measuring wasting as an indicator in this resilience response. And it's not to say that wasting isn't an important component. I think we all agree that it is, and similar to how you presented it in your framework, that it is an input to and an outcome of resilience. But I still wonder the degree to which wasting is responsive as an indicator of resilience, especially when we're talking about so many different complex crises, that treating it as a binary is maybe not really reflective of the situation. And then the second kind of part to that, and also similar to what John was asking, like I struggle with measuring resilience or wasting as a measure of resilience in the absence of programming to support that. And because of, I think if we were in a situation where people were going out and measuring cholera, but just to say, yes, we do see cholera, but not doing anything about it, there's a bit of a moral imperative there. And I know this is outside the scope of your brief, but if you're measuring wasting, which we know is highly correlated with mortality, but you're not programming to it, what is that telling you? Is there, I don't know, is there a problem with that? I wrestle with that personally, so I'm just curious what your thoughts are. Over.
Yeah, I mean, I would hope that in any program, in any resilience program, that there would be recourse to do something about it, i.e. through referral, at least, if not the, the calling forth of more humanitarian support. But there's certainly, in most cases, there's some option for referral to health centers for certainly for SAM, for severe acute malnutrition, and often there are for moderate malnutrition as well. So I think there could and should be ways to address that concern. The trick with acute malnutrition, and certainly drylands acute malnutrition that's so elevated, it's really, sometimes in a normal year it's 18%, it's high. And so I think that the trick with that is that we're probably just super close to figuring out how to address it, between biological breakthroughs related to enteropathy and some of the new literature that's come around small quantity lipid nutrition supplements. I think we're quite close to being able to do that, and I think we ought to do it. I think we need to focus on taking the bull by the horns. I thought BHA tried to do that with its, Kenya RIFSA. I don't know how much progress has been made with that. But I think we need to just, this is there, this persistent GAM is out there. We need to figure it out. And if we don't measure it, then we just kind of brush it under the rug, so that's, and where GAM is a big problem, is in terms of where it's pretty prevalent. It's not that many parts of the world. Now it could easily escalate in places that don't have high levels of GAM, where they also have high levels of stunting. But I think that the drylands problem is one that we need to fix it.
Thanks, Nancy, and thanks for the question, Rebecca. Obviously not an easy answer, but one that we're working on, and we've got a ways to go here. So we definitely appreciate everyone's time today, and we certainly invite you all to stay engaged. So we haven't had obviously an opportunity to even raise all the questions relevant here or address all of them, but if you haven't had time or a chance, we definitely encourage you to get in touch directly with the REAL team on questions related to this integration of nutrition and resilience. This is a first in our effort. We're going to keep at it. We would like to get your feedback in an evaluation, and Emily or Suzanne will put that in the chat. In that evaluation, we do have follow-up questions about whether you would like to be involved in future technical consultations and whether you know of ongoing learning efforts, including available data sets that might inform our work here. So thanks in advance for filling out that survey. Thanks for being part of today's presentation. In the time that we have left, I'd like to now hand it over to Carol Wilson, the Director for the Bureau for Resilience and Food Security Center for Nutrition, for a few closing remarks. Carol, over to you.
Hi, Tom. Surprise.
Oh, as I see, it's going to be Rebecca filling in for Carol. I just got that note. So, okay, Rebecca, please.
Many apologies. Yes, thank you, Tom. Carol had to drop off. I'm really sorry. But I did want to thank all of you for joining today, and also to our presenters. It was a really fantastic opportunity to hear more about the work that you've been doing in this space. One of the goals of the discussion that REAL presented today was to inform our technical advisors and practitioners responsible for designing, implementing, or evaluating program approaches to strengthen both resilience and nutrition. So in that spirit, we very much appreciate your engagement on this important topic. There were some additional questions I know people had. There's a link that's been dropped in the chat please feel free to add your questions. And you can also send those to our colleagues at REAL who can answer those questions if you didn't get an opportunity to ask those during the session. And I also want to thank our colleagues from REAL. I think it's fair to say that both resilience and nutrition love the use of jargon. So it's been really helpful to hear how you've defined those terms and outlined the relationship between nutrition and resilience. This is just one step in building that foundation to help us define concrete, practical next steps. And I really appreciate, Nancy, your additional thoughts in this and the discussion that you facilitated. And I also want to thank the Center for Resilience colleagues for your continued and constructive collaboration. So thank you very much for this whole presentation. We really appreciate it. And we look forward to pushing ahead with you. And I just also want to reiterate the last point that there is the survey in the chat. Please fill that out. That will help us in the next, follow on to the next award. So we really look forward to your thoughts. So with that, just thank you very much, and back to you, Tom.
Okay, thank you very much, Rebecca. I realize we're over time, so I'll just do the same. Thank everyone for your participation today. Thank you, especially Nancy, for giving an overview of the discussion brief. And look to hear from us again soon. Thanks all.
Thanks, everyone.